Hi guys, this is Preeti and you're watching my resolution. In this video, I'll be teaching you about the factors affecting the drug absorption. Once we have taken the drug, that is to be absorbed, and then it has to go into the systemic circulation and then reach the site of action. Then there it provides an action of the drug. So first it has to be absorbed. Absorption, it depends mainly it depends on many factors. Many factors affects the drug absorption. We'll discuss one by one. That is physiochemical properties of a drug. That is how it looks like. Physical state, like size of particles, everything, and chemical nature, whether it can be ionized or non-ionized, or everything will come under physiochemical properties of the drug. And we'll see the route of drug administration, whether it is administered through orally, parenterally, sublingual route, any other route of administration is the factor. And pH and ionization. Acidic drugs are more absorbed in acidic medium, whereas basic drugs are more absorbed in basic medium. Acidic drugs remains unionized in acidic medium, so it is more absorbed in acidic medium. Basic drugs are remains unionized in basic medium, so it absorbs more in basic medium. And ionization, whether the ionized or unionized form. Other factors will be presence of food may alter the absorption of some drugs. Also food also is a main factor, and then presence of other drugs, drug interaction will be there. So this factor also will discuss. And surface area, if more the surface area, more absorption will be there. And GI diseases like diarrhea, constipation, and gastroenteritis and all. And first pass metabolism, how these factors will affect the drug absorption, we'll see one by one. That is physiochemical properties of the drug, how it looks like small, large, or physical state, liquid, solid, gas, like that. If it is physical state, if it is more liquid, it can absorb faster. As the molecules are like distributed far away, it can be absorbed faster. And lipid soluble, as the mucous membrane or the where it is absorption takes place, that membrane is lipid soluble. That is lipid membrane, like dissolves in a like. So lipids can be easily absorbed through the lipid layer. So lipids are more absorbable. Lipid soluble is more absorbed than lipid insoluble. Lipid soluble are non-ionized. Lipid solubles cannot be ionized. Only water soluble can be ionized. So lipid soluble are ionized drugs more absorbed in through the mucus. And particle size, small, the thinner person can run faster than the heavier person, or like a smaller the size of the particle, faster will be the absorption. Like micro fine particles, if the particles are very small, it increases the surface area of these, and then the particles can easily move across this mucous membrane and can be absorbed. Microfine particles of aspirin are more absorbed than anti-elementals. And disintegration time, if the particles becomes disintegrated, this is a particle, this get disintegrated faster, means the time required for this disintegration is faster. So this becomes smaller particles and then absorbed faster. So disintegration time is inversely proportional to the absorption. If less the disintegration time, the time taken to disintegrate is less, then the absorption will be fast. And dissolution time is similar to the disintegration time. If the particles dissolve faster, absorption will be faster. And the formulations, as you can see, the tablets will be coated by some sugar coated, and then thin film coated, and all those. These are inert substances. Actually, they are not they don't have any therapeutic action, but still these are coated. This alters the absorption and also affects the bioavailability. Example, lactose, starch, and calcium sulfate are coated on the tablets, which acts as binding agents. They are inert, but also affects the absorption because they may be lipid soluble or lipid insoluble. Totally they are inert, but they affect the absorption. Example, presence of calcium sulfate. In calcium sulfate, there is a calcium. Calcium decreases the tetracycline absorption because it forms an insoluble compound with the tetracycline, and decreases the absorption of tetracycline. Calcium coated will decrease absorption of tetracycline. And we will discuss about the route of administration, how it is administered. If orally it is administered, it has to be absorbed, and then some might be metabolized in between, and there's other possibilities are there. But in IV, directly it is entered into the systemic circulation. It bypasses the absorption. So bioavailability means whatever the drug we have given, everything will be available in the systemic circulation. So bioavailability of these IV administration will be 100%. Some polar drugs, like polar drugs means like water soluble drugs can be ionized. Polar drugs have polar property, that is positive and negative charge, so they'll ionize easily. So the absorption of these particles will be very difficult difficult, so we have to give them directly into the blood, that is parietal route. We have to give example for this will be gentamicin, which is a polar drug. This has to be given parenterally. And insulin which is not a polar, but it is a polar because it is a protein. It is a structure containing many amino acids joined together by a peptide bond and forms it has a total 51 amino acids. These amino acids are joined by peptide bond, so amino acid means it has a NH2 group, NH2 plus, NH3 plus and COO minus. This H has come here, and in between R group some random group will be there. So it is a polar, it can be ionized. So and also one more property is insulin is a protein. Being a protein, it has been digested by the enzyme or degraded by the enzymes in the GI tract. So we should not give the insulin through the oral route, we have to give them parietally. And pH and ionization also affects the absorption. Example, strong acid, if you take strong acid HCl, it can dissociate into H plus and Cl minus ion, easily dissociate. Ionizable form, as you know, ionizable form cannot be easily absorbed. So strong acid and strong base, they can be ionized, and they are poorly absorbed in the GI tract. Whereas a weak acid and weak base, if you take weak acid like CH3COOH, it maintains equilibrium, as this cannot completely dissociate. All molecules cannot completely dissociate and maintains equilibrium. So these weak acids and weak bases cannot completely dissociate, so they remain unionized form, so they can be easily absorbed. In stomach contains HCl, that is acidic medium. Barbiturates is also acid. If acid base is present, they neutralize and forms water and then other compound. If both are acids are present, they don't react, so they remain unionized form and absorb more. Example, in stomach, barbiturates are absorbed more. Stomach is an acidic medium, barbiturates is also acidic substances, so these are absorbed more in stomach. And intestine, we to neutralize the contents, so the content of acid coming from the stomach, intestine will be alkaline medium. So morphine, which is alkaline or a base, in the intestine, which is an alkali or a base containing medium, they do not neutralize or form an dissociate to form an ions. They remain unionized, so they can be absorbed more. Morphine is absorbed more in intestine with the alkaline pH. And then presence of food. If food also affects many absorption of many substances like levodopa. In empty stomach, we have to take levodopa and rifampin, which in full stomach it decreases the absorption. So we have to take these two substances in empty stomach. And tetracycline, if you take milk products and then take tetracycline, it decreases the absorption of this tetracycline, because milk contains calcium combines with the tetracycline and forms complexes, so which reduces the absorption of the tetracycline. So along with the milk products, during the administration of tetracycline, we should not take milk or milk products. And during fatty meal, lumefantrine, which is an anti-malarial drug, which has been decreases the absorption of lumefantrine. And presence of other drugs. The presence of other drugs, when two or more drugs, if they have hypertension along with diabetics, they have to take 2 or more tablets. So they have to, during the administration of 2 or more drugs, drug interaction will be there. One drug, it affects the absorption and bioavailability of the other drug. Ascorbic acid, which is a vitamin C, which increases the iron absorption, because iron is absorbed only in the ferrous state, that is Fe2 plus is a ferrous state and Fe3 plus is a ferric state. Higher is always ic and lower will be a state. Ferrous is absorbed more. Vitamin C increases the absorption of ferrous ion by maintaining into in a ferrous state. Ferrous state means observable form of iron is a ferrous state, so it increases the absorption. And antacids which are taken during gastritis, that decreases the absorption of tetracycline by forming the I already told that forms along with the calcium, it forms a insoluble complexes and decreases absorption of tetracycline. Antacids decreases the absorption of tetracycline. And cholinergic acts on the gastritis, and that delays the gastric emptying. It keeps everything, the content will be in the stomach only. So acidic substances are more absorbed and then basic are less absorbed. absorbed, digoxin which is absorbed more, and levodopa which is absorbed less. And area of absorbing surface, whatever the drug may be, acid or base, small intestine has a larger surface area, so in small intestine the drug is absorbed more. And during resection, that is small intestine is cut and then other part is joined and then stitched, that time surface area is decreased and absorption also decreased. And during other factor will be GI diseases. In constipation, that is retained, so absorption will be, it gives more time for the absorption, so absorption is increased. In diarrhea, more loss of the content, so absorption is decreased. In gastric enteritis, peristaltic movements are increased, so it will be moving faster and then the absorption will be decreased. And colicohydria, where absence of HCl will be there. HCl was providing absorption for the Fe2 plus in the ferrous ion, so in absence of HCl, chylohydria, iron absorption will be decreased. And in GI mucosal edema, the surface is the mucosal surface is damaged, so absorption also decreased. And other factor which affects the absorption will be first pass metabolism. First pass metabolism, during oral administration, it has to go through the GI wall and then absorbed and then into the portal vein. From portal vein, it enters the liver. From liver, through the inferior vena cava, it enters into the systemic circulation. So it has to pass through all these stages. Anywhere that can be metabolized or inactivated or removed from the systemic circulation. So dosage of drug will be decreased. So when we have to give oral dosage form, we have to take a larger dosage in oral route of administration. If it has a first pass metabolism will be more, then the dosage of the drug we have to give more, because much of that will be metabolized and then eliminated in our body. So we have to give more dosage form. Example, lignocaine has a high metabolism in the liver, and isoprenaline have high metabolism in the GI wall, that can be absorbed in the GI wall, and so it decreases the bioavailability, and the bioavailability is decreased, so the concentration in the systemic circulation is also decreased, so it has a less therapeutic effect. So lignocaine and isoprenaline is not preferred in oral through oral route, but if preferred also, we have to give a large dosage form. As I think you understood all these things. Physical properties of the drug, that is smaller particle liquids are more absorbed than solids, and lipid solubles are more absorbed than non-lipid soluble, and unionized can be easily dissolved in the lipid layer, and particles are smaller the particle, larger will be the absorption, and the disintegration time is inversely proportional to the absorption. Less the disintegration time, more the absorption. Dissolution time, less the dissolution time, more the absorption. And formulations like inert substances that are coated by the tablets are coated by some inert substances, that also affects the absorption. That is, calcium decreases the tetracycline absorption by forming the insoluble complexes. And route of administration, IV, 100% bioavailability will be there, 100% absorption will be there, that directly we are giving into the systemic circulation. And oral route, it may be metabolized, inactivated or eliminated from our body. And if they are polar substances, they are ionized and they cannot be easily absorbed. Example, gentamicin. And insulin, which is degraded by the enzymes in GI tract, so we prefer parietal route. And pH, acidic substances are absorbed more in acidic medium. Weak acids and weak bases are absorbed in weak basic medium, whereas strong acid and strong base are ionizable form, so they cannot be absorbed properly, they are poorly absorbed. And food, presence of food, some drugs are like levodopa and rifampin decreases absorption during the presence of the food. And tetracycline, milk and milk products, decreases tetracycline absorption because they form calcium tetracycline complex, which is insoluble. And presence of other drugs, like if we take more than one drug, like ascorbic acid at a time simultaneously, ascorbic acid decreases the ferrous ion, increases the ferrous ion absorption because it keeps the iron in a ferrous state, increases absorption. Antacid decreases tetracycline absorption because it forms an insoluble complex. And area of absorbing surface, in small intestine has a larger area, so it absorption will be more. And GI diseases, in constipation absorption will be more, and then diarrhea absorption is less. First pass metabolism, less than the first pass metabolism, more will be the absorption. And if you find this video is helpful, please do like, share and subscribe to my channel, and appreciate my efforts.